Well, a new technology is allowing patients to have it a little bit easier when they're under the weather. It's called telehealth visits.
As Caitlin Williams tells you, the help you need from a doctor is now in the palm of your hand.
How many times have you sat in the doctor's office far past your appointment time, and not to mention in a room full of potentially contagious people? Well, that may be a thing of the past, but traditional doctors don't seem to buy into it. Apps like Doctors on Demand, Amwell, and MeMD have one thing in common. They connect you to a doctor that can dramatically cut down time and cost when it comes to recovering.
So the process is very simple, although it looks complicated. Patient decides if they have an issue, or they may not know if they have an issue that can be fixed from a telehealth visit. So they call MeMD.
Dr. Jelani Ingram of MeMD tells us all you have to do is pay the $50 fee, insurance is not accepted, and then provide some information about your medical history. A care coordinator will speak with you, and if your condition is telehealth suitable, the doctor will be coming to you.
I call the patient back as quickly as I can, and we get the visit underway, and most patients are happy about it because it's usually something that can be fixed fairly quick without having to even visit the waiting room in the doctor's office.
But keep in mind, not all health concerns warrant a virtual visit.
There's a lot of patients that I do send to the ER. There's a lot of patients I do send to just the primary care doctor or urgent care clinic. Most of those issues deal with next level problems.
Dr. Ingram predicts there will be a growing trend in telehealth, but not all doctors feel the same. Dr. Mohsen Syed of Concierge MD in Midland says without a physical appointment, patients are losing the intimacy of doctor visits.
Call me old-fashioned, but I like to examine a patient, put my hands on the patient to make sure what I'm doing to them or giving to them is going to work for them.
However, what lacks in the personalized care, Dr. Jelani says, is made up when you sit down and look at the costs.
You are significantly reducing the cost of that healthcare service. You're reducing the wait time. You're reducing actually how much the employer has to spend on hours lost from the patient leaving their work.
When you log in to MeMD for a consultation, you are connected with a different doctor every time unless you request otherwise, which Dr. Syed says breaks the trust between the patient and physician.
It's just the satisfaction that the patient gets, when they see a physician who they trust.
Some doctors will choose to keep their practice strictly face-to-face.
My patients are here in Midland, Texas. My patients are, I see them all the time. I know my patients.
And some will be available for you from the comfort of your home.
Patients like it because they can actually request appointment times from MeMD, and we can call at their leisure, or they don't even have to leave work to be able to be treated for common problems.
Some of the conditions that can be treated online include bronchitis, insomnia, allergies, urinary tract infections, and many more. For a complete list of ailments that can be treated online, please visit the website on your screen. Caitlin Williams, News West 9.